As the country becomes more tolerant of marijuana use, it's now legal in 29 states for either medical or recreational use, there's an increased perception among teens that it is safe. But the American Academy of Pediatrics has a new report out with strong warnings for parents and doctors. Pot is not benign, it says, and can cause abnormal and unhealthy changes in the still developing brains of teens. Dr. Harris Stratyner, Regional Clinical Vice President of Care and Treatment Center's New York Recovery Services, joins us now with strategies for parents. Welcome, Dr. Stratyner.
Pleasure.
So good to see you here. One of the things that the report points out is that marijuana today is about 20 times as potent, as strong as it was maybe about 20 years ago.
Right.
Is that right? And is that...
Yeah, it's probably a little less than that, but it is the level of tetrahydrocannabinol is much stronger. It is not the marijuana that was smoked in the 70s.
And so is that leading to increased addiction levels?
Yeah, I would have to speculate, and also based on some of my research, that indeed it is. And some of the things we see at Care and Treatment Center, we're seeing 92.1% of adolescents who are admitted to rehab, their primary drug of choice is marijuana. That's unbelievable. That is
unbelievable, especially since the report has some good news, which is that overall drug use in teens is down.
Absolutely. As a matter of fact, we've seen tobacco use and alcohol go way down. Marijuana among seniors and high schools across the nation is around 26% use. So some people say that's lower.
And it's even now more popular than e-cigarettes among teens.
Oh, absolutely. It absolutely is.
And is part of that this perception that it's okay among teenagers? I know some teenagers who say to me, they've said, you know, look, it's legal, it's natural, it's okay, it's no different than alcohol, which also we know that alcohol can cause damage to the developing brain. But how do you talk to a teenager like that? I mean, how do you reason with them?
First thing you have to do, and we say at Care and Treatment Center, is talk to your teenager calmly, but talk to them. Be direct. You know, I practice a school of psychology called carefrontation. It says treat people with respect and dignity, don't shame or blame them, but hold them responsible. Youngsters, and I blame my generation, the baby boomers, because they smoked pot, and some of them still smoke pot with their kids. So at Care and Treatment Center, we recognize that addiction is a family disease.
I will point out that the American Academy of Pediatrics recommends parents who smoke marijuana to not do so in front of their kids.
Absolutely, and I would even go one step further and tell them not to smoke marijuana.
Right. Well, in the states where it's legal as a recreational drug, you know, it becomes different from alcohol, because plenty of parents drink alcohol in front of their kids. I do, right? But
absolutely,
it seems to be different. It seems to be something that we need to handle differently in front of our children, and that we need to talk about differently with our children.
Very much so. You know, just because alcohol is legal, and alcohol is the most dangerous drug there is,
sure.
But just because alcohol is legal doesn't mean we then have to compound the fracture, if you will, and add marijuana to being legal. 28 states. You're looking at also medical marijuana, and that confuses kids even more. Then they go on the internet and they start talking to uninformed youngsters.
Right. So let's point out that according to this report, regular use of marijuana by kids and teens may contribute to addiction, depression, psychosis, lung problems, memory, and attention problems. So your young people should know this. They should have these facts.
You need to understand what we at Care and Treatment Center call evidence-based facts, evidence-based practice. We don't deal with things that don't work. Our work at Karen is based on research. And I will tell you, we know for a fact, I as a researcher and also a professor at Mount Sinai School of Medicine, can tell you that the adolescent part of the brain that continues to develop through the age of 25, the prefrontal lobe, is very affected by marijuana. It affects your motivation, your memory, your judgment, your reasoning ability. Is that really what you want when you go into school and trying to get into college?
Absolutely not. So again, as a parent, be respectful of your teenager, but be clear about the dangers of marijuana use.
Exactly.
What other advice do you have?
Don't give mixed messages. You know, don't say, do as I say, not as I act, because they will always do as you act.
Right.
And really, whatever you do, and I know some people may say, is he crazy? No, I'm not. Don't smoke marijuana with your kids. Don't try to show them that you're hip and that's the way you're going to connect with them, because you're really doing harm to their brains.
Very, very good advice, Dr. Stratyner. Thank you so much for coming in to see us.
Oh, it's my pleasure.